Chapter 27, Thorax and Abdomen. In this chapter, you will learn about the injuries related to the thorax and abdomen. These include rib fractures, pneumothorax, kidney, urethra, and bladder contusions, liver contusions, appendicitis, scrotal contusions, injury to the spleen, hernia, and blow to the solar plexus, also known as getting the wind knocked out, and finally, stitch in the side. We will also cover the basic concepts of evaluation and treatment as we discuss each condition. The thorax is the portion of the body often referred to as the chest. It is the area from the base of the neck to the diaphragm and includes the thoracic vertebrae, the 12 pairs of ribs, and the sternum. The main functions of the thorax are to protect the lungs and heart and to assist in breathing. Please refer to the textbook for an explanation of the corresponding anatomy listed on the presentation. The abdominal cavity lies between the diaphragm and the pelvis and is surrounded by the lower ribs, abdominal muscles, and spinal column. The abdominal muscles includes the rectus abdominis, the internal and external oblique, and the transverse abdominis. These muscles assist in trunk flexion, rotation, and lateral flexion. Draw an imaginary line vertically from your head, down the middle of your nose, over your sternum, and past your belly button. Now draw an imaginary line horizontally from your waist to intersect your belly button. You now have 4 quadrants that divide the abdomen and assist you in locating the primary organs. If you raise your left arm high in the air and palpate under your rib cage, you will be palpating over the spleen. The spleen is the largest lymphatic organ in the body, and it functions to store and regulate red blood cells, destroy ineffective red blood cells, produce antibodies for immunity, and produce lymphocytes. Now raise your right arm over your head and palpate under your right rib cage. This is where the liver is located. The liver is the largest internal organ in the body. It consists of 2 lobes, the right and the left. It performs digestive and excretory functions, absorbs and stores excess glucose, processes nutrients, and detoxifies harmful chemicals. It also secretes bile, which is used for neutralizing stomach acid and digesting fat. Now place 1 finger in your belly button and using your other hand locate the anterior superior iliac spine on your right side. This is the large prominence that's attached to your hip. Locate the middle point between these 2 landmarks. This is called McBurney's point and is where the appendix is located. Also, located on the lower right quadrant is the large intestine, kidney, and for females, the ovary. In the lower left quadrant is also the large intestine, kidneys, and for females, the ovary. Take some time to become acquainted with these 4 quadrants and the primary organs located in each quadrant by using the information from the textbook and this presentation. Refer to the textbook and this presentation to understand how to prevent injuries to the thorax and abdomen. A blow to the rib cage can contuse intercostal muscles or produce a fracture. Rib fractures are not uncommon in sport and are most prevalent in wrestling and football. Most fractures are from a direct contusion, but they can also occur from a violent muscular contraction. Sometimes rib fractures occur from forces caused by extensive coughing and sneezing. Ribs 5 through 9 are the most commonly injured, and multiple fractures can create a flailed chest, which causes a breathing emergency. Fractured ribs create severe pain, especially when the athlete attempts to take a deep breath. He or she will often hold the injured side and will take shallow breaths, similar to the panting of a dog. Refer the athlete to a physician for X-ray. If the athlete is demonstrating signs of shock, implement your emergency action plan immediately. Simple rib fractures requires 3 to 4 weeks of rest and support with a commercial rib brace. Pneumothorax means air in the thoracic cavity which is where the lungs are located. This cavity becomes filled with air from a rib fracture or puncture wound to the chest. The excessive air pressure collapses a lung. The athlete will experience pain, difficulty in breathing, and anoxia, which means low levels of oxygen. The management includes the implementation of your emergency action plan for immediate referral to a physician. Hyperventilation occurs during excessively rapid breathing, which creates an imbalance of oxygen to carbon dioxide in the blood. The excessive loss of carbon dioxide makes the individual breathe harder and deeper. It's not that they can't get enough oxygen, it's because they have an imbalance of oxygen to carbon dioxide. Some individuals experience this because of stress, injury, or illness such as asthma. Other athletes, such as swimmers, voluntarily hyperventilate to enable them to perform longer underwater. This is a dangerous strategy as the athlete may pass out without warning. The treatment for hyperventilation consists of having the athlete slow down the rate of respiration and concentrate on inhaling through the nose and exhaling out of the mouth. The athlete can also pinch one nostril and breathe out of the other. The third technique involves breathing slowly into a paper or plastic bag. However, this maneuver is receiving controversy in the medical community. Once the hyperventilation episode has resolved, it's important to identify and treat the cause of the condition to prevent reoccurrence. Kidney contusions occur primarily in collision sports where the low back is exposed. A kidney contusion may not cause pain and other symptoms initially, so it's important for you to take into consideration any previous blows to the low back when the athlete comes to you with symptoms. These symptoms will range from pain, spasming of the low back muscles, and blood in the urine. Refer the athlete immediately to his or her physician for observation, testing, and possible hospitalization. Contusions to the ureters, bladder, and urethra are rare, especially if the athlete empties his or her bladder before practice or participation. Pain from a contusion will occur in the lower abdomen. There will also be rigid abdominal muscles, nausea, vomiting, and signs of shock. Blood may also be dripping from the urethra or evident in the urine. Treatment includes a doctor's evaluation with possible treatment. Liver contusions are the second most frequently injured abdominal organ in sport. A blow to the right side of the rib cage causes this injury. The athlete will experience referred pain below the right scapula, in the right shoulder, and below the sternum. Shock will also be present due to possible hemorrhaging. Refer the doctor immediately for diagnosis and treatment. Be aware that symptoms of liver contusion can be delayed. The appendix is a 4-inch tube attached to the large intestine. Its function is not clear, but it may be part of the immune system. Some believe that it assists in digestion years ago when our diets were more plant-based. Sometimes the appendix becomes inflamed and infected from fecal obstruction, lymph swelling, or in rare cases from a cancerous tumor. Males are inflicted with this more often than females. Appendicitis can mimic gastroenteritis, which can be dangerous if the appendix bursts. Signs and symptoms include mild to moderate pain in the lower right quadrant. Again, locate the McBurney's point, which is the halfway mark between the belly button and the superior spine of the ilium. Pressure over McBurney's, referred to as the rebound test, will cause pain in appendicitis. The individual may also have a low-grade fever, nausea, and vomiting. Sometimes the individual, when instructed to stand up straight and jump, is unable to do so because of discomfort. It is important to refer the individual for medical attention where blood tests and ultrasound will be used to diagnose the condition, followed by surgical removal if needed. A direct blow to the scrotum causes intense pain, nausea, and sometimes vomiting. The athlete may also experience complications of delayed swelling and spermatic cord torsion. Calm the athlete down and implement one of the following techniques to reduce the spasm. First, have the athlete squat down and gently bounce up and down. Second, have the athlete lay back with his knees and hips flexed to 90 degrees and instruct him to bear down. Ice pack should be applied for 20 minutes to reduce swelling and spasm. If the pain is unresolved or the athlete experiences secondary swelling, he should be promptly referred to a physician for further evaluation. Spleen injuries occur during a fall or a direct blow to the lower left upper quadrant. Mononucleosis, referred to as the kissing disease, results in an enlarged spleen, which makes an athlete prone to spleen injury. Because of this, athletes with mono should not participate in sports for at least 3 weeks. The signs and symptoms of a splenic injury include referred pain to the left shoulder and arm. This is referred to as Kerr's sign. The athlete will also experience shock, abdominal rigidity, nausea, and vomiting. The danger of splenic injuries is its ability to splint itself and later resume hemorrhaging. The athlete should be referred to a physician for evaluation, hospitalization, and possible surgical repair or removal of the spleen. Hernia refers to the protrusion of abdominal organs through a tear in the abdominal wall. Hernias can be congenital or acquired. Inguinal hernias are more common in men, whereas femoral hernias are more prevalent among women. Hernias can be irritated by movement, falls, and blows. Another dangerous concern is when the hernia becomes strangulated, which means part of the intestine protrudes through the hole and becomes stuck. This causes decreased blood flow and intense pain and tenderness. A hernia can be routinely diagnosed during the athlete's pre-participation physical. Surgical intervention is the treatment of choice. The solar plexus is located in the abdomen just below the ribs, and it contains a large network of nerves that innervate the abdominal area. When an athlete receives a hard blow to this area, he or she experiences a transitory paralysis of the diaphragm, which means that normal inhalation and exhalation becomes altered, thus the term getting the wind knocked out. The athlete will experience great anxiety because of the difficulty to breathe. It is important to provide emotional support by talking in a confident and calm manner, loosening the clothing around the abdomen, having the patient bend the knees, and instructing him or her to take small inhalations and long expirations. Be aware that such a blow to cause this condition may also cause an internal organ injury. Be vigilant for delayed signs of pain, shock, nausea, and vomiting, and refer the athlete to a physician for further treatment if needed. This is a cramp-like pain that develops under the left or right rib cage. Some athletes will experience pain in the related shoulder or trapezius muscles. There are a variety of causes for this condition that include constipation, gas, eating prior to activity, and spasm of the diaphragm because of poor conditioning. Weak abdominal muscles may also cause this, as well as inappropriate breathing techniques and issues with the underlying organs. It's important for the athlete to empty the bladder and bowels and to avoid a large or fatty meal prior to extensive activity. Proper breathing techniques should also be instructed. To treat, the following methods can be employed. First, have the athlete stretch the affected arm as high as possible. Second, have the athlete flex at the waist and contract the abdominal muscles. And third, alternate walking with exhaling in each step. So if the athlete experiences pain on the right rib cage, he should exhale when stepping on the left foot. If chronic stitch in the side occurs, evaluation by a physician is warranted.